Hi, everyone, and welcome to Mental Health Education. My name is Jessica, and I'm a medical student who believes in the power of education. I hope that through these videos, we will end some misunderstandings and/or fears about mental health. As a reminder, these videos should never be taken as medical advice. Please speak to your providers if you are in need of treatment for any type of illness. Today, we will be discussing the disorder known as Attention Deficit Hyperactivity Disorder, commonly called ADHD. Our case example is a 12-year-old female presents to her pediatrician's office for a well child checkup. The pediatrician asks if there are any complaints today. The patient's father laughs and says, "Try getting this one to focus on even telling you what's bothering her." The doctor asks him to continue. He reports that ever since starting middle school 9 months ago, his daughter has been going through a rough time. Her teachers are always calling him about her forgetting her glasses or homework and that she is easily distracted by her classmates. She still hasn't figured out her schedule and often walks into the wrong classes. She doesn't even listen to her soccer coaches and never does the drills right. She was so excited to start soccer, but says she doesn't like it now because the directions are too hard. She always had a hard time focusing, but ever since she started at the new school, she can't seem to keep up. I keep telling her she's got to try harder since she doesn't have the extra support she had in elementary school. She is so smart and capable, but she came home crying the other day because someone at school told her she really needed to get her head out of the clouds. I'm concerned because I remember when I was growing up having similar issues and wound up never liking school and dropping out when I was 17. I don't want that for her. Our patient is most likely struggling with symptoms of ADHD with a predominantly inattentive presentation. Throughout this video, we will discuss the symptoms of ADHD and some of its different presentations, and hopefully by the end, it will become clear how our patient fits the diagnosis. According to a national 2016 parental survey, 9.4% of U.S. children have been diagnosed with ADHD. Boys are much more likely to be diagnosed with ADHD, with 12.9% of boys having this diagnosis compared to 5.6% of girls. It is important, however, for doctors to assess for ADHD whenever a child is having difficulties with attention and/or hyperactivity. Of course, children are rambunctious and love to play more than doing homework, but ADHD is much more than just that. A study found that 32.3% of students diagnosed with combined type of ADHD, meaning they have both hyperactive and attention issues, drop out of high school compared to 15% of teens without psychiatric disorders. Children with ADHD are much more likely to not reach their full potentials and in later years develop anxiety disorders and/or depression. It should also be noted that one-third of children diagnosed with ADHD will continue to need proper treatment as an adult. Let's talk now about how to actually diagnose someone with ADHD. People must have symptoms of inattention and/or hyperactivity/impulsivity that interferes with daily functioning. Issues with inattention are diagnosed as the following. Children up to age 16 years need to have 6 or more of the symptoms, while people age 17 and older need to have 5 or more symptoms. The symptoms must also be present for at least 6 months, and they are inappropriate for developmental level. The patient often fails to give close attention to detail and/or makes careless mistakes, usually has trouble holding attention on activities, often does not seem to listen when spoken to directly, does not follow through on instructions and fails to finish assigned duties, often has trouble organizing tasks and activity, often avoids or dislikes activities that require a long period of mental effort and loses things necessary for tasks, and is often easily distracted, and finally, is often forgetful in daily activities. Issues with hyperactivity and impulsivity are diagnosed as the following. Children up to the age 16 need to have 6 or more of the symptoms, while people age 17 and older need to have 5 or more symptoms. The symptoms must also be present for at least 6 months and are inappropriate for developmental level. First off, the patient often fidgets or taps hands or feet, often leaves their seat in situations when remaining seated is expected, often runs about or climbs in situations where it is not appropriate. For adolescents or adults, this may be limited to feeling restless, is often unable to play or take part in leisure activities quietly, is often on the go, acting as if driven by a motor, talks excessively, blunts out answers before a question has been completed, often has trouble waiting their turn, and often interrupts or intrudes on others. In addition to the above criteria, the patient must also have several inattentive or hyperactivity/impulsivity symptoms before age 12, and several of the symptoms are present in 2 or more settings, such as home, school, or work, or doing other activities. Now, it is important to remember that there are 3 presentations of ADHD. Combined presentation is when both criteria for inattention and hyperactivity/impulsivity were met. Predominantly inattentive presentation means that the patient has enough symptoms for inattention, but not hyperactivity/impulsivity symptoms to be met. Predominantly hyperactivity/impulsivity presentation means that there are enough symptoms of hyperactivity/impulsivity met, but not inattention. It is also important to mention a potential symptom for patients with ADHD called hyperfocusing. When this occurs, patients are able to sustain long periods of time on something very stimulating, such as video games or a TV show, but on tasks which they are not interested in, they can experience great difficulty with concentration. The exact cause of ADHD is still unknown, but it is believed to be a mixture of genetics and environmental factors. Risk factors for developing ADHD include having family members with the disorder, exposure to toxins such as lead, and premature birth. The specific neurotransmitters thought to play a role in ADHD include dopamine and norepinephrine, but more research is needed to find the exact pathway as to how. Patients and family members should know that they are not alone with this disorder and there are treatments that can help. As always, lifestyle modifications should be addressed. These include things such as regular exercise, getting outdoors, and eating a healthy diet. Parents should also be encouraged to speak with their children's school in order to allow for special services, such as extra time on tests or different accommodations. Therapy is also very important for these patients. Behavioral therapy often targets on helping children learn time management and organizational skills. Family therapy can also be very helpful to learn how to set goals and expectations for routines. Medications can also be highly effective. Usually, the first line medication in ADHD are called stimulants, but there are other medications that can be used. As always, your doctor will weigh the risks and benefits of starting any medication. I do want to pause for a moment though and mention that sometimes people are concerned that medications for ADHD are addictive because they are stimulants. Illicit stimulants that patients become addicted to cause a flood of dopamine in the brain and produce the euphoria people can feel. Please watch my video on substance use disorders for more information on this mechanism. Stimulants that we give our patients, when used correctly, however, do not cause a surge of dopamine. Instead, it is a slow and controlled release over a period of time. The patient's brain thus never sees a flood all at once and never experiences euphoria. In contrast, this slower release of dopamine is very important for patients with ADHD because it helps people improve their focus and attention. Now, it is also important for us to address that several people misuse ADHD medications, may take these pills even though they are not prescribed them, and or may take the medications by methods other than those prescribed by a healthcare provider, such as snorting the medication. One study showed that approximately 5 to 10% of high schoolers and 5 to 35% of college students had misused ADHD medications. It is important for people to realize, though, that if they do not need the medication or use the medication inappropriately, they can become addicted. There are, however, other ADHD medications that do not work in the same process, and if there is concern for abuse by caretakers, doctors may prescribe these medications instead. As a short side note, if you are struggling with any type of addiction, remember there are providers who can help. I hope this video was informative and helpful. At the end of the day, remember, the most important thing is for patients and their loved ones to receive the proper care and treatment they deserve. Thanks everyone for watching!